We have about 5 minutes for questions, if there are any from the audience on either of the excellent presentations or on hepatitis B. In general, we're happy to open up the discussion since we know this is one of the few hepatitis B sessions. Yes, right here. I'm sorry, could you turn the mic on?
Thank you. Hi. Yeah, I'm a specialist nurse from Wales in the UK. So the question I think that Beatrice and Frida, you alluded to was about a central registry, a national registry of vaccination history. We don't currently have that, certainly not in Wales. And I'm just wondering if there are any examples of sort of health passports or central registries that maybe the panel has or the delegates in the audience have today that we can sort of pinch and share and... Thank you.
Okay, I can go first. Thank you for your question. The city of Philadelphia has a system called Philavax, which theoretically is supposed to document vaccination for everybody, but it's not the most organized. There's definite holes in record keeping. Not everyone has access to it, so not every person who administers a vaccine is able to log it in the system. And there's not a passport of any kind that I'm aware of, at least not for Hep B. The strongest example was for the COVID vaccine, where that did exist, and those records were very well kept. But I can't say the same has been done for Hep B. So that's definitely something that still needs to be achieved.
Do you have anything to add, Frida, on registries?
I could just say that in Sweden we have this national vaccination register, but not all are registered there, so it's not total coverage there. We started with that for a few years ago, so we don't have like long data. So yeah,
Still in development.
Still development, yeah.
Thank you. I think there's a question on the left side of the auditorium.
Good morning. I'm Dr. Ajit from India. And India, we are promoting vaccination not only in healthcare workers, but also in high-risk groups. So one thing which I've seen in both the presentation is that there were cases of around 10% who have only antibody to hepatitis B core antigen positive. So like in India, what we do whenever there is somebody who's having only antibody core positives, we also check for hepatitis B virus DNA to look out for occult hepatitis B infections. So the prevalence is around 10 to 20% to find like there is no hepatitis B surface antigen, only core positive, and then you go for DNA, and 10 to 20% you'll find DNA is there, and they need treatment. So any experience regarding that?
You can go ahead first.
We don't have that as a routine to look for HPV DNA, but of course that's a good suggestion to do that, especially of those with affection in the liver, the samples, like if they have affection of the liver. So yeah, that might be a good idea actually.
I agree, it's a very good idea. For the study that we conducted, we did try to recommend or refer anybody who was isolated core positive to further testing. Linkage to care was challenging for a number of kind of structural reasons, but that is the next step that we usually try to follow. And anyone also who is core antibody positive, we reflexed for hepatitis delta as well.
Thank you. I think we have time for one more question. There's one down here. Oh, I'm sorry. I missed it up there, the light. I think was there one in the middle? Or up there on the very top right. Sorry, lights.
Oh.
Hi, my name's Lynn. I'm a nurse from prisons in Australia. This question's for Beatrice. I don't know anything about the United States. Is your Hep B vaccinations free for everybody? Anybody?
No, that's one of the big problems. So the universal vaccine recommendations came out from the CDC in 2022, which is a great step. But now the next step is for the United States Preventative Services Task Force to make those recommendations, because that's the body that insurance companies listen to. So they have said that they will take it up for consideration in 2025. We'll see if that happens. There's not a great deal of urgency on their part, but once they do hopefully recommend that, then insurance companies will pay for it, and then hopefully it will actually become more widely available and have greater uptake. But as of right now, it's not free. No, so.
Thank you so much for joining. I don't want to miss your question, but we'll stick around if we can just answer it directly up here. I just think there's a symposium at 12:15 that we need to clear for. But thank you for joining this session on hepatitis B vaccination, and we look forward to continuing the discussion.